Yes, this one's mine. I totally have. I know I shouldn't be proud of it, but I think it's hilarious.
Let's be honest, when you really need to pee and you don't have a bathroom, then you finally get to the bathroom, there's definitely leakage.
The first time I noticed it was this summer. We put up our trampoline, and I was so excited to get on there, jumping, doing flips, having fun with my little one. And then I quickly found out that I cannot jump without peeing my pants. Like, a lot of leakage.
Had to pee, kind of, but was like saving it up for a little more. And then something really funny happened. And I just leaked a couple drops, as you do.
Urinary incontinence is when you involuntarily leak urine or pee, and you didn't want to. Stress incontinence is when there's an actual stressor to the system, like a cough, a sneeze, a laugh, or maybe even a run, and it causes so much pressure in the system that it causes you to leak. Urge urinary incontinence is when you get this strong, sudden urge to go so badly that you can't make it to the toilet, and you leak. Mixed incontinence is when there's a combination of both.
I think urinary incontinence is actually very normal, but it's not the norm we should accept, although we do. Like I said, there's a lot of shame that goes along with that. And just like those chin hairs that we get on our chin, we just pluck and just nobody knows. It's no harm, no foul kind of thing. I think it's a similar thing with incontinence where we're leaking in a lot of instances, like even just a sneeze where we cross our legs to help prevent ourselves from leaking. Totally guilty there. I think it's something we just try to learn to live with, which, yeah. So I think it's unfortunately quite normal, common.
I think especially if you're a mom, I think, yeah.
I don't think it should happen often.
All I know is that giving birth is what causes it. No one has ever asked me about it, said anything. Doctors, medical people, they've never mentioned it. It's kind of almost like, okay, this is just something that happens. It's like, if you give birth, it's the price you pay.
I feel like I haven't really been told anything about it. Like, it wasn't really something my female elders in my family spoke to me about. But I think as a uterus having person in this world, from like advertisements and stuff, I've been taught that it's normal for older women. Like, you see a lot of ads for Depends and Poise and stuff that, like, ladies who look like Jamie Lee Curtis, like, wearing these, like, you can barely stand under my mom pants.
I would guess that you lose the elasticity of your muscle.
I have not been told anything about pee leakage ever. I just assumed that, if and when in jumping up and down and then causing a little pee, it was normal.
There are a couple of different reasons why UI might occur. Things like age and genetics you can't control, but there are other things that you can control. For example, any kind of weakness or tightness at the pelvic floor muscles can cause incontinence. I always say a tight muscle is never a strong muscle. It's actually a weak muscle because you've been using it so much that it doesn't actually work when you need it to work. For example, pretend like you're carrying a bag of groceries like this with 2 gallons of milk for 10 hours. When you put that bag of groceries down, you're probably not going to beat a 2-year-old in an arm wrestle. In the same way, if you're holding a lot of tension at the pelvic floor when you need to hold and clench so you don't pee, it actually might not work. Urinary incontinence can also happen because of obesity or pregnancy. Imagine you have a hammock and you put a bowling ball on top of the hammock. The pressure and the weight of that bowling ball is going to stretch and lengthen that hammock. Similarly, weight on your abdomen or anything above puts more pressure onto the pelvic floor. The other thing is constipation. If you're constantly straining on the toilet and exerting pressure onto your pelvic floor, that's another reason why you might be incontinent.
Definitely different for people like my mom who's had, kids. I think that makes it harder if you're going on a road trip or something, or like it makes it a lot harder to be trapped in a place for really long.
I don't know, inconvenience when it happens. It's just uncomfortable.
why can't I just like sleep all night without having to like get up to pee? You know, it seems like that's something that you should be able to do, or I don't know, maybe it's not, but it is a serious problem for me, is peeing all night and feeling like I don't do it nearly as often in the day. So maybe there's something there.
There are certain types of behaviors that are universal. So going 6 times before you fall asleep, going 6 times before you get on an airplane, right? You see, when we used to travel and you would go, it was just crazy. Like you could just sit in the waiting area, just watch people going back and forth. That's actually not a bladder problem. That's muscular. That's a pelvic floor problem. The opposite of too loose, where the pelvic floor gets tight and tense because of nerves, anxiety. If it's cold, like when you're cold and you have to urinate, that's tension on the pelvic floor, squeezing the urethra, giving you a sense that you want to urinate. And so when you urinate, you feel better, and then the muscles tighten up again. And as soon as you get back to bed, you feel like you have to go. That's behavioral. That can be treated. That's all physical therapy and behavior modification. But those behaviors are learned, and they can be unlearned. The other behavior is the whole, like, go to the bathroom before you leave, the whole thing where your mother's always like, go to the bathroom before you go, but go to the bathroom here, and you wind up going to the bathroom so much that it's like Pavlov's dog, right? You're constantly going to the bathroom. So you can untrain yourself to not do that. You should hold it. You should be able to go 4 or 5 hours and get up once a night at the most, and not be urinating constantly because you're trying to drain your bladder.
Incontinence can interfere with the quality of your life. So many people tell me that they don't drink enough water because they're going to pee themselves, or they can't go on long car rides because they're going to have to stop a million times to pee. People have told me that they can never get on a trampoline with their kid because they're going to leak, or that they can't go running outside or exercise in public because of the embarrassment from peeing themselves.
I don't know, like, do Kegels help? I don't know. Is it even like the right area? Who knows?
Yeah, I have a sense of inhale. All right. So uplift, not this, but, and in the same time I'm doing the uplift, I'm doing the opposite of clenching. I am relaxing.
Drinking less water. It's like
As a general rule of thumb, you should always check with your pelvic floor physical therapist on whether you are strengthening your pelvic floor muscles correctly or not, and if strengthening right now is the right thing for you. For many of my patients, I will help them retrain their pelvic floor muscles, because while they might think they're doing a pelvic floor contraction or a Kegel, they might actually be squeezing their inner thighs or glutes. The beauty of a pelvic floor evaluation is learning what is the right way to do this. Once a pelvic floor PT can teach this to you correctly, it's great to practice Kegels and reverse Kegels 3 sets of 12, 3 to 4 times a week.
Other end of it is that there are treatments for all of these things, that you don't have to live with it. Exercises don't work for everybody. There are women who need medication. There are women who need surgery. There are women who benefit from Botox injections, nerve stimulators. There are lots of different things that we can do to help women who are incontinent so they do not have to live with it. So getting expert advice and looking at all your options is really, really important, and not being embarrassed to come forth and say to your gynecologist, who's usually the first person you would present this to, I got this issue. I'm not that happy about it. I'd like to figure out what my options are, because there are a lot of things that can be done.
Remember, both men and women have pelvic floor muscles, so strengthening is equally important to both. Lengthening is equally important as well. It's also great to contract your pelvic floor muscles before and during a cough or sneeze to prevent unwanted leaking. Not surprisingly, vaginal delivery increases your chances of leaking, with 35 to 67% of women having UI during pregnancy. Also, urinary tract infections, constipation, genetics, age, and obesity can increase the risk. Women who have given vaginal births and have had UTIs in the past should be mindful.
The shame that's associated with women's vaginas and their their sense of being dirty and out of control, especially when it comes to urinary incontinence, where women come in and they'll be like, I just can't control myself. And they're so embarrassed, and they spend a lot of time hiding pads and hiding from their spouses, avoiding having sex, feeling dirty and smelly. And there's this sense of like failure, that I am failing because I can't control myself. And it's very sad and painful to see that feeling of shame, because it's like, it's, first of all, it's only urine and it's not your fault. And it's like, what's the big deal? And there's a pervasive feeling of failure. And the truth is that we are animals, right? We have discharge and we have secretions, and we urinate, we defecate, and sometimes we're messy. And that's part of being who we are. So there's men, because I'm a urologist, I see a lot of men, they don't have the same perceptions of their excretory functions. They talk about farting, and they talk about, going to the bathroom, and they pee in public, and they pee in front of each other. And we have this, as we age, it gets more and more shameful. Our bodies become a source of embarrassment. And we need to recognize that we are functioning human beings who are aging and changing, and this is all part of the process, and embrace the good and fix what you don't like.
The bottom line is, if you're experiencing urinary incontinence, go get help. It might be a laughable subject, but at the end of the day, if it's interfering with the quality of your life, there's no point in suffering alone. Get help as soon as possible.